The sinuses are air spaces in our skull bone. So every human being has sinuses. We have sinuses below the eyes, or the cheek sinuses, also called the maxillary sinuses. We have air spaces in the forehead, in the bone there, called frontal sinuses. We have between the eyes, called the ethmoid sinuses. And we have sinuses behind the eyes, called the sphenoid sinuses. And these sinuses normally produce mucus which drains in the nose and you swallow it without knowing. However, they can get in trouble. And what kind of trouble can they get into? One, they can get infected, whether it's a viral infection or a bacterial infection or a fungal infection. And when the infections come in, they can be treated with drugs. However, if they persist, then surgery would be recommended, depending on the circumstances the patient presents with. Sometimes the sinuses can be troubled by tumors. And these tumors may be non-cancerous tumors like polyps, but sometimes they can be troubled by malignant or cancerous tumors. And so patients will present in different ways. Some will present with a yellow nasal discharge for a long time, where a long time is in terms of days and weeks and months. Some people will present with nasal blockage. Some people will present with fevers and high temperatures. And so if someone has nasal symptoms, it's good to visit an ENT and have them evaluate you. Sometimes you will require even doing investigations like CT scans and x-rays to evaluate and see if your sinuses are troubled. And if they are, they will then consider to do either drug treatment or sinus surgery. And nowadays in our country, Uganda, we are able to do sinus surgery without creating scars on people, outside scars on the face, what we call minimally invasive sinus surgery. And so you don't have to look any further. You don't have to travel to India and to Nairobi, Aga Khan. We can do these surgeries in this country.